Just name and designation.
Dr. Gilberta St Rose.
All right, so
I'm an integrative healthcare practitioner from the Creative Health Center.
All right. So just tell me what you're doing here today and what's going to be taking place.
So today it says to be case management for our case against the Medical and Dental Council for the suspension of my license in December 2021. So although I've been reinstated by the judge on February 18th, 2022, well, you know, there's a case against the council for doing this suspension, which was very much out of order.
Right. And so what are some of the outcomes you're expecting? What do you want to see happen?
Well, the outcome, in fact, I'm asking for mediation because this is such a waste of time. My time, everybody's time, you know, court's time, of course, taxpayers' money, with the council bringing their 2 lawyers and all of that. But at least, hopefully, there'll be some more awareness by the public as to, you know, how injustice can manifest. But more importantly, I hope the council is taking stock of itself in terms of what it has done. And of course, there's always the opportunity for, you know, redemption, apology, and move forward.
So what do you say? You're seeking an apology from the council? Because I mean, for a time they kind of hindered you from doing your practice and whatnot.
Well, an apology plus, apology plus, you know, but the apology needs to be forthcoming so that the public can gain some more confidence in them. And also the Ministry of Health. Luckily, the Ministry of Health has redeemed themselves to some extent by allowing me to bring in ivermectin for, you know, the freedom and benefit of all people so that they can be treated for their various conditions. So that is one step forward. But we'd like even more from the council in terms of protecting the public from this COVID injection, which, you know, is still being advertised as something that they should be taking in spite of all the evidence, you know, internationally and locally, of course, but they're not putting it together. But persons know of the adverse effects and they still haven't put something in place to document it, which is very sad. And the Medical and Dental Council should really be the one taking responsibility for allowing such a biological agent to be out there, being advertised and, you know, encouraged by the Ministry of Health to put into people's arms in spite of all the evidence that, you know, nowadays you have a cause of death called suddenly. Have you heard of this? What's the cause of death? It's sudden adult death. And persons are having more strokes, having more inflammatory conditions. They are going to get autoimmune diseases because of the way this injection works. So I think the Medical and Dental Council should remind themselves of the responsibility of protecting the public in spite of the fact that the public is being adversely affected by our Ministry of Health and the government of St. Lucia, which, you know, to some extent their hands are tied, but of course being complicit, it's still a crime.
And do you think the actions of the Medical and Dental Council at the time were wrong? Do you think that they shouldn't have done that to you?
Yeah, it was wrong because, you know, I was trying to educate them. You know, I got information, I was bringing it to them, they were not listening, so I brought it out to persons, the persons that were being affected, the man on the street, the patients who would have died. Some have lived because they used ivermectin, and they always thankful. They, you know, I'm still meeting people that are thankful for having had the opportunity of using ivermectin. So they should have listened. They should have listened to, you know, what just not me have to say, but it was what I was gathering based on the research occurring in the international community. Right. So they have been negligent.